Good morning, everybody. I want to thank everybody for coming out on this perfect Saturday morning, although at least they do have air conditioning. Who would have thought we would have to say that in September in Colorado, but you know, it could snow tomorrow. So I really want to thank everybody for coming out today. This is the first in a series of 4 town hall meetings we're having this month on the Affordable Care Act. You've been hearing a lot about the Affordable Care Act for the last 3 years, and some of it is correct, some of it is incorrect, some of it's confusing, and so I thought it would be a good time after Labor Day, after the kids are back in school, to have some town hall meetings to talk to my constituents about the insurance marketplaces that are going into effect on October 1st, so that people can ask questions not just about the marketplaces, but about any of the issues in the Affordable Care Act. And so you can start to be thinking about how this is going to affect you. We have a wonderful panel joining us today, and I'm very glad that they are here because they are the experts. They can answer the questions that you have. I'm going to introduce them in just a minute, but I thought it would be worthwhile to talk with you first a little bit about the Affordable Care Act, what benefits folks can already get, and what's coming next. So, as you probably know, we've been trying to figure out how to reform our healthcare system for decades. When we started Medicare in the 60s, to Ted Kennedy's efforts and John Dingell's efforts in the House, to President Clinton's efforts. A lot of politicians have spent their entire careers trying to figure out how to reform the healthcare system. So 3 years ago, we took a big step forward with the passage of the Affordable Care Act. Now, as somebody who is a member of the House committee that has primary jurisdiction over the Affordable Care Act and helped write the House version of that bill, I want to say to you, is it a perfect law? No, it's not a perfect law, but it does lay the foundation for a healthcare system where every American can either go in and get a health insurance policy that will give them affordable health care, or can be eligible for Medicare or Medicaid, our federal safety net programs for older Americans and for the poor. It's also about making Americans think about wellness and prevention, economic security and entrepreneurship, and the welfare of working families. And so what we're really trying to do with this historic law is have a healthier America. And I just want to talk to you about some of the things that have happened already because of the provisions of the Affordable Care Act. Across the nation, 105 million Americans have gotten preventative services like cancer screenings and vaccines without co-pays. 3.1 million young people under 26, including one in the DeGette household, are now covered under their parents' health care plans. 6.1 million seniors in the donut hole, the Medicare donut hole for prescription drugs, have already saved $5.7 billion. And the small business health care tax credit has already been used by 360,000 small businesses. Right here in Colorado, about 1.3 million adults and children with private insurance and almost 300,000 people on Medicare have gotten preventative health. 1.9 million Coloradoans are free from worrying about lifetime limits on coverage. This is what happens when somebody has a pre-existing condition or a disease. And if you'll recall, in the past, insurance companies would put a cap, a lifetime cap, and after that cap was reached, they couldn't get health insurance benefits anymore. Many people became bankrupt and became impoverished because of this. No longer will that happen. And about 210,000 residents of Colorado will get $27.5 million in rebates from insurance companies this year because of the provisions of the Affordable Care Act. And so a lot of these provisions, the pre-existing condition, the lifetime cap, the benefits, the health care benefits for preventative screening, all of those things that already have gone into effect can't be sustainable in the long run unless we bring the roughly 27 million people in this country who were not in health insurance into the system. Because what happens then is the only people in insurance are the older and sickest people, and then the rest of the people who don't have insurance, many of whom can't afford insurance, end up using the emergency room as their primary care. And then, of course, the costs go up for everybody, not just those people, not just the hospitals, but every single one of us. And one thing the Affordable Care Act was designed to do, not to eliminate insurance increases, which were going up at record rates in the last 10 or 15 years, but to slow the growth in our nation's healthcare costs. And in fact, since the Affordable Care Act became law, U.S. healthcare spending has only grown by 3.8%, which is the lowest growth rate in 50 years in the United States. And the law already led to nearly $2.1 billion in savings to consumers in just 3 years. So now, all of those benefits are just the beginning. The key component of the law is the establishment of these insurance marketplaces where individuals and employers can purchase insurance from companies that are competing against each other for business. And the goal of the exchanges in Colorado, the marketplace, is to make sure that, that everybody gets access to that same kind of competition that large employers and large plans have been able to get before. The name of our marketplace is Connect for Health Colorado. So starting on October 1st, with coverage that will go into effect on January 1st, 2014, individuals and families will be able to access the marketplace and purchase insurance through the web, through the phone, and in person at health assistance sites. So all of the plans in the marketplace, there's 16 plans, there's 16 insurance companies in the individual marketplace in Colorado, and there's 9 for small businesses offering a variety of different plans. All of those plans will have minimum benefits, and then they'll go up from there. So as you'll hear from the panel in a minute, people will be able to go online or one of these other ways I talked about and look at what they need for themselves and their families and to purchase insurance in these marketplaces. According to the 2011 Colorado Health Access Survey, about 800,000 people in Colorado didn't have insurance, and about 675,000 were underinsured. In the Metro Denver area alone, there were 116,000 people who were uninsured. And so what this marketplace will allow people to do is go in and buy that health insurance. And the more people we can get into insurance, then the more affordable that's going to make our insurance. Aside from the marketplaces, the Affordable Care Act makes significant changes to the insurance system, and some of which I mentioned before. Starting in 2014, your health insurance can't deny you coverage because you're sick or because you have a pre-existing condition. They can't put a lifetime cap. They can't require higher co-pays or co-insurance if you get emergency care from an out-of-network hospital. And in a real breakthrough of common sense, they also can't require you to get pre-approval before you go to the emergency room for a provider or a hospital outside your network. I don't know if any of you recently went to the emergency room. I did. And I did not look up, I'll confess, I did not look up who was under my preferred providers before I did that. And I bet you nobody else does either. Private insurance plans now have to tell you why a claim has been denied, and they have to let you know how you can dispute that decision. Insurance companies now have to pay 80% of premiums on covering medical services, rather than administrative costs and CEO pay and profits. And that's why people got the rebates last year, because of that medical loss ratio issue. And that's why we've also seen billions of dollars in savings. So for women who are here today, the ACA might be the greatest single advancement in women's health in a generation. And why? Well, you'll be glad to know it's no longer a pre-existing condition to be a woman. Wow. They can't charge us, insurance companies can't charge us more than men. Women across the country can access birth control and other essential preventive services without co-pays. And since the key component of the Affordable Care Act was implemented, 47 million women gained coverage of these preventative benefits without cost sharing. You heard about some of the benefits for kids. Kids with pre-existing conditions can't be denied either, and basic pediatric services have to be covered. There are a whole panoply of benefits for seniors. They can receive preventative services like flu shots, diabetes screening, and wellness visits. The donut hole, as I mentioned, is partially closed, and it goes on. I want to spend a minute. You know, I told my staff, you've got to time us. So they're being ruthless. They're timing me. Good work, Christina. So, but I do want to take a minute and talk about the tax credits, because for many Americans, not only will they be able to go on to the exchanges and buy health insurance, but they're going to get federal assistance in premium support to do that. So starting in 2014, premium tax credits will be available to low and middle income people to help them better afford this private insurance. About 466,000 Coloradoans will be eligible for premium tax credits, and in the metro area, over 104,000 will be eligible for that. The vast majority of Coloradoans will be eligible for premium tax credits, and they'll be in working families. But it's not just businesses, individuals, also small businesses will also be able to get tax credits. And so if you're among the eligible small businesses, or if you're among the eligible individuals, when you go and talk to the exchange, you will be able to find this out. And starting in 2014, small employers with up to 50 employees will also be able to buy, as I mentioned, buy insurance on the exchanges. So I just want to tell you a little story in conclusion about a friend of mine and why it's so important that people know about this. This is a woman I know. She is an esthetician in a beauty shop, and she's about my age, in her late 50s. She had a pre-existing condition, but she knew she had to get insurance. She's self-employed. And so she went and she bought a private insurance policy through the state of Colorado, through an insurance plan, through an insurance company plan. And she's paying $800 a month for her insurance plan. Now that's probably pretty close to half of her income, I would say. So I was telling her about the exchanges, and she didn't even know that they existed. And I said, well, you know, if you can go on the exchange, you can get a plan that works for you, that gives you the screenings and the prevention you need and all the things you need, and I'm sure you'll save money. And she said, boy, that'd be great to save a couple $100s a year. And I said, I think you might save a couple $100s a month. So for people who have their insurance plans and they like their insurance plans, keep them. That you do not have to go into the exchange. For employers who have insurance for their employees, they can keep that insurance for their employees. They don't have to drop that insurance. But for the millions of Americans whose employers don't give them insurance and who haven't been able to afford insurance on their own, and for the small businesses who would like to be able to give insurance to their employees, help is on the way, because there will be competition in the exchanges and there will be premium support for those who do it. So it's really worth looking into. We're here to answer your questions today, and I want to thank such a wonderful group of people for coming. And I want to now introduce our panel. I'm going to introduce them all at once, and then we'll just go down and have each one of them make their presentations. You can come up here if you want to, or you can stay there at the table, whatever works better for you. And after the town hall meeting, health guides will be available out there in the lobby to actually help you right here with questions that you might have. We can't start signing you up yet. That doesn't happen until October 1st. But people can ask you questions about your particular situation. So first of all, we have Doyle Forrestal. She's the Acting Regional Director for the U.S. Department of Health and Human Services. She's going to give us some broader perspective on how the Affordable Care Act is being implemented. Next, we have Tim Gaudet. He's from the Small Business Majority, and he's here specifically to talk about how the Affordable Care Act will work for small businesses. He has a lot of experience in the business world and has worked in a small business himself. And last but not least, we have Jessica Dunbar from the Connect for Health Colorado, who's going to tell us how this all works. Right, Jessica? Okay. And after they make their presentations, then, if you have a question, we're going to have you write it down on a card. And I don't know if we have...
They're on the chair.
They're on the chairs. So if you do have a question, write it down and pass it to the aisle. My staff will pick it up. We'll sort through it to make sure we get a wide variety of questions, and then we'll answer as many of your questions as we can. Thank you so much, and take it away.
Good morning, everyone. I'm Doyle Forrestal. I'm the Acting Regional Director for the U.S. Department of Health and Human Services here in Region 8. Our region actually covers Colorado, Utah, Montana, Wyoming, North and South Dakota. So within that 6-state region, we've spent the last several years talking about the new healthcare law, the Affordable Care Act. We're very lucky to be here in Colorado. One of the things that I just spent the last week in South Dakota, and it's so wonderful to see such a large room of people. When you go to a state that has about 800,000 people, I was actually in Pierre, their capital, there in South Dakota, and we were lucky to have about 20 people in the room when we were doing exactly this type of presentation. I think as we get closer to the new health insurance marketplace being open starting October 1st, people are really starting to ask a lot of great questions. And so we have to thank Congresswoman DeGette for doing such a wonderful overview of the law and all of the panelists who will help answer a lot of specifics. We spent, since the law passed back in 2010, about a year and a half, Marguerite Salazar, new Colorado Insurance Commissioner, who used to be our regional director, we traveled around our region doing presentations, exactly the information that Congresswoman DeGette just gave for you. We would spend about an hour and a half going through. So she did a great job touching on all of those different pieces. But I really want to reiterate just a couple of things because there has been so much misinformation. You know, once the law passed, we had the Supreme Court decision looming, and then that was settled in June of 2012. And now we've really just been moving forward on implementation. The states had a lot of discretion to do what they wanted to do with this law. They could decide to create their own health insurance marketplace, which Colorado did. They have a lot of decisions to make about qualified health plans and various different pieces of the law. So we really have to thank our state folks who are also here today. Lorez Meinhold with the State Department of Healthcare Policy and Finance, and Joe Donlin is here also with the Insurance Commissioner's Office. And of course, all the folks from Connect for Health who are working very hard to get the new insurance marketplace up and running. But very briefly, just want to remind everyone, the whole goal of this law really was to help those individuals who don't have insurance or are paying too much for the insurance that they currently have. For about the 85% of Americans who have insurance, they've seen a lot of the benefits that Congresswoman DeGette just mentioned. Better preventive services with no out-of-pocket costs. Our seniors are getting a break on their prescription drugs and also getting those preventive services we know they need. I will have to reiterate as we go through the various provisions of the new marketplace and talk about the specifics there. We're getting a lot of questions from our seniors who are on Medicare. So I want to let you know, you do not need to do anything. You don't have to go into the marketplace. You don't have to make any decisions. And so if someone calls you or claims that you need to make some changes because of this new marketplace, it just simply isn't true. You all who are on Medicare and are enjoying a lot of the new benefits because of the law, you don't need to do anything. For the rest of the Americans who don't have insurance, a new day is around the corner, really starting in just a few weeks. So the new health insurance marketplace, many of you may have heard it referred to as an exchange. It's actually written into the law as an exchange. But what we found is that a lot of people don't know what that is. They think stock market or some other type of system. So we're now moving that to what we call the health insurance marketplace. And here in Colorado, it's Connect for Health Colorado. The way that this is going to work really is for individuals and families who don't have insurance or maybe aren't happy with the coverage they have, or small businesses. We know small businesses pay about 18% more than large companies to provide insurance for their employees. So this will give them new options, new purchasing power, really giving them the opportunity to select a plan, both individuals and small business, that meets their budget. We hear a lot from families, and especially small businesses, who say, we want a budget, we want to know what we're going to be providing for our employees or for our family, and we need to know how much that's going to cost. So you can pick a plan that fits your budget. You can be assured that it's a quality product. In order to be sold on the marketplace, it had to meet a minimum standard. And from there, you can select what benefits make the most sense for you, what out-of-pocket costs work for your budget, and really be assured of what you're purchasing. So, and they're telling me 5 minutes, but I'm very close to being done here. Just want to let you know that the marketplace it does open October 1st, as the Congresswoman mentioned. For this first period of open enrollment, we're going for 6 months, so it doesn't end until the end of March. So for folks who need insurance today, if you get signed up by December 15th, your coverage will begin in January 1. And also, we really have to thank the state and the leadership in the state for the Medicaid expansion. The idea behind the marketplace is this no wrong door concept, that you fill out a simple application and you can figure out either what insurance makes the most sense for you, or perhaps if you're eligible for Medicaid or CHIP, and be directed to the right place in order to get those benefits. So we really will be able to cover a lot more people here in Colorado, both through the Medicaid expansion and this new marketplace. We expect about 90% of the folks who are going to shop on the marketplace will get some type of premium assistance. And so that, on a sliding scale, will be, the people will be able to put in their household income. It's already up on the Connect for Health website. Put in what your household income, and it estimates what type of premium assistance you might be able to expect. And then from there, select a plan that makes the most sense for you. So again, we want to make sure, especially because we're talking about a population who may not have ever had insurance before, that they understand what an open enrollment period is. That this really is that time that they need to go in, shop for insurance, similar to those of us who have insurance or the Medicare open enrollment period. This is when we need to try to get folks enrolled into some type of coverage. Of course, if you have a life-changing event of some type, if you lose your job, or there's a death in the family, or some other types of things that might cause you to have a change in your circumstance, you can then go into the marketplace outside of that open enrollment. But other than that, we really need to make sure that we get people into the system as quickly as we can. In future years, the open enrollment period will match exactly Medicare open enrollment. So that's October 15th through December 7th. But for this first year, we do have that extended period, so we can try to get folks in. So really the bottom line about these new health insurance marketplaces is that it's an easier place for you to shop for insurance. It'll be online. You'll have an opportunity to work with health coverage guides like today to get assistance in person or over the phone. This really is for individuals and small businesses to shop for that insurance that fits their budget. The state had a lot of flexibility, and all of our states did. Colorado was the only state in my region that selected to run their own, so we're very lucky we'll get to hear from them today. That financial help is there. That if you don't have insurance, you're nervous about being able to afford it, exactly the story that Congresswoman talked about, those are the stories we've been hearing for years. We need to make sure that folks know that this is going to be an affordable option for them, and they really can select what makes the most sense. And that assistance, because we know insurance can be confusing. We want to make sure that you have the help that you need in order to get and select the plan that makes the most sense for you. We've heard from a lot of folks who have, we all have used the analogy, in fact, because the new marketplace is available online, that it might be, when you're making that apples to apples comparison, it's a lot like shopping for travel Picking out where you want to go and what flight to take. A lot of people have said, well, I feel comfortable doing research online, but I'm not sure I feel comfortable purchasing that product without a little bit of assistance. So we want to be sure that we have a lot of help for you, whether it be over the phone or in person, as you're making these very important decisions. So we'll be here to answer your questions as you go through this process. I want to thank the Congresswoman for inviting me to join you and look forward to talking to you more. Thank you.
Good morning. My name is Tim Gaudette, and I am the Western Outreach Manager for an organization called Small Business Majority. And I will be talking about one aspect of the small business discussion and decision called the Small Business Tax Credit. Can I have the next slide, please? Allow me a moment just to tell you a little bit about us. We are an 8-year-old national nonprofit small business advocacy organization. Started and founded, run by small business owners ourselves, and we know that healthcare is the primary issue facing small businesses going forward, and that has been our focus for the last 8 years. For the last 3.5 years since the passing of the law, we've been doing this type of education and outreach around the country, and I've been doing it here in Colorado for the last 15 months. As you see, we're spread across the country. We're active in many of the states where they are doing state-based marketplaces. And we are not a typical business organization. We are not based on membership, dues, or sponsorship. We do independent research of small businesses across the country to get their thoughts on these issues that we believe are important to them, and that's what we advocate with and for. And again, very focused on education and outreach in Colorado and nationally. And not to steal Jessica's thunder, but we are part of something within Connect for Health Colorado called the Assistance Network. That is a group of over 50 organizations around the state doing education and outreach to individuals in small business. We are focused primarily, 95%, and that's again part of the bigger business discussion, on small business. Kind of think of us as I-25, border to border, is where we're going to be regionally located. And if I can, I'd like to introduce two of my staff. We have health coverage guides, or as many people may know them as navigators. I have Emily Dewey and Stephanie Salazar Rodriguez here with me today. We are available starting now and through the next 18 months of our grant to help small businesses learn about what is available to them. Before we get into some of the framing of the small business market, I want to ask a quick question. How many small business owners are in the room today? Okay, how many of you have 50 employees or less? Okay, you don't have a mandate. I just want to make sure people understand that, because unfortunately the messaging has either not been existent or has been wrong. At 50 employees or less, you're not under any requirement to offer care. However, there is an opportunity, there are some attractive things that we'll talk about that might be of interest to you. And I would highly recommend working with the Assistance Network, working with brokers, working with your financial experts, tax people as well, to make sure you're fully investigating this opportunity. So, surprising, costs is the issue. We've done research over the last 8 years, again and again and again. It's the fact that small business, by definition, insurance is the spreading of risk. The smaller groups, it's harder to spread the risk. So, small businesses, which are 96% of all of our businesses, those under 50, 1 out of 3, 1 out of 4, whether you're self-employed or a business, struggle to provide care, to get care. That's tough. The large group market, 50 employees or more, 96% of those businesses have a product. In America, vast majority of our population get benefits through employment. The small business employer has, just by definition, had a tougher time to get health insurance, and they want to. We know from our surveys they would love to have a product for their employees because they're invested in their employees. They know them much more intimately than large corporations. It's just they couldn't afford it. Next slide, please. Again, this is just another proof. Vast majority, 70%, say they can't afford it. And the status quo is troublesome because those who do provide it, many are struggling to keep the care. They've taken it from perhaps a high percentage of the premiums they paid, they pushed it down onto the employees. They're at a point now where they don't know if it's tenable or not. And then in Colorado, according to the Kaiser Family Foundation, we have about 32, 1 out of 3 businesses with fewer than 50 in Colorado offer care. That's about a percentage point less than the national average. And we have about 97, almost 98% of the businesses with more than 50 that do provide care, and that's above the average. So again, the large group plan is a stable, healthy, competitive, robust marketplace. The small group market, a little different. So, the small business tax credit. What you'll see here is about 70,000 of all of our Colorado small businesses, or about 68% of them, are eligible for a tax credit. However, most small businesses don't know about it, and that's troublesome because we're going to try our best to get everyone to know about it. And then there is a sliding scale, but 27,000 or almost 28 will be eligible for the maximum credit available. So, who qualifies? In Colorado, prior to the Affordable Care Act, we did have a situation in our small group market that a business group of 1, a self-employed person, could shop in that market. However, due to the national law, this is going to be for businesses with employees 2 to 25. It takes effect immediately. This tax credit has been around for the last 3 tax years and is available this tax year. However, going forward, in 2014, it will only be available through Connect for Health Colorado Marketplace. It's available right now in the general insurance marketplace, but it will only be available in the new marketplace going forward. So, fewer than 25 full-time employees, average annual wages for those employees of $50,000 or less, and an employer who pays at least 50% of the premium costs. Those are the requirements. This is a for-profit slide, but nonprofits also are eligible. For most of the businesses out there, it's on a sliding scale. Right now, you can get up to 35% of your premium expenses paid by the company back. Starting in 2014, up to 50% of the premiums can come back to you. The premium expenses include comprehensive medical, dental, vision, and long-term care. The tax credits do not cover the premium expenses of owners or their families. That is because often in the small businesses, owners and family members are the highest paid and they already have coverage. This is trying to get the employees coverage as well. You can take the credit and you can still take your health care deduction. And again, it is still available. If you've been providing care and you might qualify, you can go back with your tax professional and possibly amend your taxes for several years and receive these credits. This is an awful slide because it's really hard to see, but most of our businesses in the small group area are about 10 or less. The premium tax credit scales toward those businesses. The premium kind of maximizes at the 10 employees or less, low wage $25,000 or so area, but as you go out you can still receive credits, but it is on a sliding scale. And I have to give a shameless plug. Small Business Majority on our website, smallbusinessmajority.org, has a free small business tax credit calculator that we'd love you to take advantage of. It is also embedded in the Connect for Health Colorado website as well. For nonprofits, how many nonprofits do we have? You're a small business. I know many nonprofits may not think that way. You think maybe you're perhaps more mission driven or something, but you are small businesses and you do have a chance to get a credit. That right now is up to 25% of your premium expenses, going to 35%. The it is considered a tax refund. Many of you know a 990T, and you do not have to publicly report that. IRS.gov has a very good section of their website on healthcare and these forms that I'm talking about. Small businesses will include the amount as part of their general credit. It will not be against their employment tax, but toward their income tax. Most small businesses estimate quarterly taxes, I believe. You can use this credit calculation in your quarterly estimates. And again, if you have no taxes, you can carry back 1 year or forward 20. So while we have a lot of information on this, we always stress get in touch with your tax professional as well. And I think as we get close to wrapping up, it's always good to have a story to talk about. How many people here are into bicycling? Okay, great. In Colorado, when you're on a bicycle and you're kind of serious about it, you're either on top of a mountain or very, very far away from your car or home. What that means is you really want a good bike technician, Retail is one of the industries where it's not always common to find benefits. However, John Crandall, down in Colorado Springs, the Old Town Bike Shop, has been providing health coverage for his employees for quite a while. However, due to the cost curve that we've been on, he's found it very, very difficult to continue to offer it. He kept pushing more of the costs on his employees. John got educated, John learned about the tax credits, and over the last several years has gotten thousands of dollars toward his premium costs that he's shared with his business and shared with himself, or with his employees. So he's been able to actually invest in his business during the recession and do quite well. Resources, healthcare.gov. Again, smallbusinessmajority.org is my organization. We have a small business section specifically called healthcoverageguide.org. Not trying to be confusing, but we had that name before Colorado named their navigators, so don't need to be confusing. And what you'll find is our tax credit calculator, a summary of what's in healthcare reform for small business, and a 21-page frequently asked questions document that I would love you guys to download for free. If any of this sounded interesting, you want to know more about my organization, we have a network manager. We have about 20,000 small business owners following us, about 4,000 small business organizations that have worked with us over the last several years. Emma in our Washington office can be reached here. We're on Facebook, we're on Twitter, and we'd love to hear from you. And then my information should be next. And again, I'm Tim Gaudette. I am just up the street in Park Hill. It's my phone number and my email address. We will be out in the hallway afterwards if you have some more interest. We have business cards. We can set up appointments. We'd love to hear from you. And I think I'm done.
Hi everybody, my name is Jessica Dunbar and I'm the individual market-based manager at Connect for Health Colorado. I want to thank Congresswoman DeGette for allowing me to share and for just setting up this wonderful opportunity to educate and explain what we're building and how it benefits people in Colorado. And I think everybody set a great stage for me. So some of this information may be a bit duplicative, and I'll do my best to elaborate and provide more detail where I can. Before I dive into the slides, I did also want to make this a bit personal too, and why I'm so passionate about what we're doing. I wanted to take a poll of how many of you in the room can think of either it's a personal story, someone you know who didn't have insurance and paid financial consequences because of that because they had to access care. How many of you have insurance or had insurance and you accessed services and you were very thankful that you had that coverage afterwards? And I think we could all be in this room for hours and hours sharing these stories because they are personal. They do, we want to be able to protect our health and our livelihoods and our financial security. And I can just say for myself, a year ago I went through a very scary period of time with my 3-year-old son who's very healthy, and I got a phone call saying I had to come pick him up because he was having a hard time breathing. And I rushed to the emergency room. We ended up at Children's Hospital, and intervention after intervention, he ended up being sedated and put on a breathing tube, and we spent the next 2.5 weeks in the ICU while he recovered. And for him, he is a vibrant, amazing little boy, and he got hit with a virus. It was a virus he got it is viral pneumonitis, and on top of that, he developed pneumonia, and it was in a matter of hours. And I can just say, looking back at that period, it was a very vulnerable, scary time. But I'm so thankful that we live in a place like Colorado where we have a place like Children's Hospital where he got incredible care. And following that episode, he came, I can say we made it through the other end. He is doing great now. And I'm just, we got a huge bill afterwards, but I am thankful that we didn't have to pay a large percentage of that because of the comprehensive coverage that we had. And I know that it can play out in different ways if people don't have the coverage they need, and that's why I'm so passionate about what we're building in Colorado through the marketplace and with the expansion of the Medicaid program, where people now can have that they can easily figure out what options will be available to them. They can find a plan that best meets their needs, and a lot of us touched on this, that one reason the major reason people don't have it is because it costs so much money. And we're working to build now these new systems so people can see what kind of financial help they can get, and that purchasing that plan won't break their monthly budget. So I wanted to start there to say I'm excited. We're so close. October, we've been marching towards October for years now. Senate Bill 200 passed in 2011 to create the state-based marketplace. And we have had incredible input and advice over the last 2 years as we've designed this system and try to make it work best for individuals and families looking for coverage and small businesses. And so just like what was said earlier, people will, starting in October, be able to go online, and there are going to be over 150 plans for individuals and families to choose from. They can compare these plans side by side, drill down with the health benefits in those plans so that they can really make an informed decision and pick what's the right fit. The marketplace is the only place in Colorado where people can get now these new tax credits, and we've talked a bit about it all morning, and I'll explain a little bit more about how it works. And we are building a huge support network around the state, recognizing that, I thought it was said well earlier that people can shop and they want to look around and browse, and I think a lot of people will want to go to experts for advice when they are really ready to purchase and make sure that they feel confident about that decision. And so we have a variety of ways that people will be able to do that, in person, over the phone, online, and then be able to, just like a lot of websites today, you can literally pick that plan, put it in a cart, and process your payment. Yes. So I'm going to cover a little bit about what we are and what we're not. Colorado specifically chose to create this new marketplace as a separate organization that serves as a nonprofit. We are not a replacement for the current market or brokers. We partner with brokers, and we have about 1,300 that have signed up to go through our training. So we're very excited to have that partnership with brokers and agents. We are not involved in negotiating rates between insurance companies and providers. We really are this place where insurance companies are now offering those products, and we're helping people with the decision to purchase. We're not a part of Medicaid, we're not a state agency or a regulatory body. It's not a place where people will be going to get to look for Medicare or sign up or get a supplemental plan. And we don't receive any money from the state general fund. We have received federal grant dollars to get up and going, and in the future we have to be a self-sustaining organization. So we, through the marketplace, are serving individuals and families and small businesses. I'm first going to touch on the individual side. I think we've covered a lot of this information. I'll skip actually to the next one. So who can shop? Obviously there's a big uninsured population, and we want to reach out to them, help them understand now the new options. We also want to help people understand that if they purchase insurance for themselves and their family today, they don't have to change, but they can come and see what new options may be there and what financial assistance. So we want to help people know that there is that choice, and they can come look around. People that are self-employed can come to the individual market. There are some, if they are not offered coverage through an employer, they can come and shop. And sometimes the employees are covered, but not their dependents or spouse. and they also can come to the individual market and find a plan. Next. So this is a bit of a busy slide, but I wanted to kind of lay it out that we've built this online technology to be really dynamic, and people can come and first of all, they can, maybe they're not ready to fill out an application and make a decision, but they want to just look around, and that's one shopping path. They can come, they can enter just a little bit of information about their zip code, their age, things that impact their plans that are made available, and then they can go to the shopping site and be able to compare and look around, and even if they like something at that point, they could put it in a cart and then move to the application. A second path is to be able to use just a quick calculator to see what, based on your income and the number of people in your household, what kind of financial assistance is available. So people could be, after they put in some of their information, maybe eligible for Medicaid or CHIP, or now these tax credits on the marketplace. And we're trying to build that calculator. Well, we've built it so that people can quickly see what kind of savings are available to them. And then from there, go and browse plans. And then there's the actual, I'm ready to enroll, fill out an application, make a decision. People can always choose to just purchase a plan and not go through to see if they qualify for financial help. That's one path. And another path is to go through a financial application process to see what program someone could take advantage of. Next. So what's going to be available on the marketplace? Well, we're excited that we have what was mentioned earlier, 16 carriers that are decided to partner with us and sell products on the marketplace. And those products can be PPO plans, HMO plans, some the CYA cover Colorado Young Adult plans. We actually, I know I have to tell a story. These are called catastrophic plans. And we were trying to say, okay, well, what's a way we could kind of rename this? And our actuary raised his hand. He's like, what about CYA? I think actually a lot of people could relate to that. And especially, and they're available to for young adults and people that have been exempt from the individual mandate. They can see these specific, high deductible plans. People can also look for plans that have dental coverage embedded within them, and some of these plans will not. So if dental coverage is also something that you're looking for, you can buy separate dental plans all in one shopping and purchase experience. And we're also helping people get access to vision plans too from our website. And when people fill out an application, they end up being eligible for Medicaid or the Child Health Plan, or Child Health Plan Plus program. We will help them get enrolled into that too, through our partnership with the Department of Healthcare Policy and Financing. There's been some discussion about how all these plans meet specific coverage levels, and you can see a list of all these benefits that will now be covered under with the qualified health plans on the marketplace. And there's also a new way that these plans can be compared side by side, and they're referred to as metal tiers. And the gist of it is, when you look at a bronze plan, let's say, you'll know that all those bronze plans, that you as a consumer would have to pay 40% of the claims incurred under that plan, and the insurance company would pay 60%. So if you're looking for more comprehensive coverage, you would choose a higher metal tier plan, and they range from bronze to platinum plans. And when people are shopping on the website, they'll be able to sort and filter plans based on what's a priority for them. So if you just want to look at premium prices, you can look at them all that way. If you want to look at all the bronze plans offered by all the insurance companies, you can do it that way. a lot of people, have an established relationship with a doctor, and we wanted them to be able, as they look for new insurance, see if their doctor is in that network, and so they can type in that person's name and be able to see the plans that will be available. So we're really trying to make this dynamic. You can customize it to fit your needs and what you're looking for. So a little bit more about the tax credits. They're available to people who have income ranges as an individual between roughly $16,000 and $46,000 a year. For a family of 4, that could be as high as $94,000 a year. And so, like what was mentioned earlier, we estimate about 500,000 people in Colorado can take advantage of this. And these tax credits, if somebody will be able to figure out if they're eligible, and when they move on to shopping on the marketplace, all the plans can be adjusted according to that after that, what it would cost the person after that tax credit is applied. And so when someone enrolls in a plan, that tax credit is paid to the insurance company, and the person pays that difference on a monthly basis for the premium. There's also, go back one more time. There's also a decision to be made around the tax credit. People can get the full amount up front and save that money on a monthly basis, or they can choose to not take all of it, or actually get all of it as a refund at the end of the year. So there's some, people can kind of decide in thinking about that year ahead, what may happen in their life and how much of that tax credit they want to take up front. One important point too is that when people are receiving this tax credit, we want them to report it to us, or any changes to us, so we always make sure that they're getting the right level throughout the year. And we'll be able to help them if they, let's say, had a decrease in income, that tax credit could go up and they would save more money on a monthly basis. Or, just depending on the circumstances, no matter what, we want to help people understand that there are these implications when they file at the end of the year, and we'll help them get that right level. There are also financial assistance available to reduce out-of-pocket costs. And so people that are under between $16,000 and about $29,000, making about that much a year, they can also get help with reducing their co-payments and other out-of-pocket costs with the plan. And when they went to the marketplace shopping page, they would already see those out-of-pocket costs reduce. So the tax credit, this is a slide to just show how it also works on a sliding scale. For people that are at closer to the $16,000 range as an individual, they would only have to pay about 3.3% of their income towards that premium, and that would work out to be about close to $5,000 of the tax credit that year, based on a plan that costs $5,000 a year. So the Congresswoman, she talked about the thousands of dollars that could be saved for some people. It's real. You can see these numbers here. And as someone's income goes up, they still could be saving hundreds of dollars with a plan that was purchased. So this is a quick example of how it would work. Let's say there's a man named Bill who's 40 years old. He came to the marketplace and he's earning $30,000 a year. He would come tell us that he wanted to apply. We would figure out that he would qualify for $166 of the, per month in the premium tax credit. And then he would go to shop and he found, let's say, a plan that costs about $375 a month. And after that tax credit is applied, he would pay that insurance company $209 a month for that plan. So you could see that monthly savings. I've touched actually on some of these, the importance of reporting any changes to us, and that people have a choice if they want to take the full amount or something, or get a larger refund at the end of the year. And that Cost sharing, it's possible for people to receive both the tax credit and the out-of-pocket reductions if they're within a certain income range. And eligible Native Americans can enroll in health plans that have no co-pays and deductibles for in-network services. So there are special benefits for the people in that population too. A few other key changes, and I think a lot of these were also covered. There's this extended open enrollment period. We want people to have several months to be able to shop, purchase a plan. And if they do experience something that is a qualifying event, like a loss of job, marriage, divorce, birth of a child, that could open up another period for them to shop out between March and October of 2014. And people can apply for Medicaid and CHIP throughout the year. That open enrollment period doesn't apply. So a little bit more about the small business marketplace. This is another shopping path. Employers will be able to come to the marketplace and be able to set up, I'll kind of move along here. I'll skip this because this was covered. I wanted to focus on this. When small employers will be able to offer a wider range of choices and options to their employees on the marketplace. They can work with one carrier, one plan, one carrier, all the plans offered by that carrier. They could, let's say they want to offer the bronze, metal tier plans from all the carriers to their employees, or they could offer, let's say, bronze and silver plans across all the insurance companies. So there really will be a lot more choice and options available to employees to be able to find a plan that works best for them. And I'll just elaborate a little bit more. When an employer can select these plans that they want to offer to the employees, and then the employer can also decide how much to contribute towards those plans. They could set that as a percentage or as a flat dollar amount. And so we're trying to allow for flexibility for that employer to be able to set it up the way they want to. And we're also providing premium aggregate billing for all the employees if they're enrolled in with different insurance companies. So that's another service that we're trying to help with. There are a wide variety of groups that we're training right now to be able to offer assistance, so people can get questions answered online through chat and decision support tools. We're building a customer service center where we'll have over 100 people available to take phone calls and answer questions and walk people through the whole process. We are training brokers and agents around the state to be certified to help people in the marketplace. There's been talk about the health coverage guides, and that is through a program that Connect for Health Colorado is running called the Assistance Network. And basically, through this Assistance Network, we're able to offer grants to community-based organizations and county offices to be able to hire health coverage guides whose job will be to do outreach enrollment services. And so they'll be able to get out in their neighborhoods to reach out to people, help them understand what options are now available, and help them with the shopping. And then there's also another group of people called certified application counselors, and a lot of these people will be working, let's say, in a clinic or a clinical type of setting where people coming in, they want to see what they qualify for. They'll help them with that application process and get them on the coverage. Protecting privacy is also a huge priority for us, and I want to assure everyone that we've built really robust security and privacy systems to protect information. And the last slide, really the benefits, what we're trying to get out there across the state is to say that this marketplace will be an easily accessible place where people can shop for and make decisions about health insurance. It's a one place they can get access to tax credits, And we've trained and hired a huge network of people that can help you along the way. And it really is our mission to help provide that access to the coverage so we can all protect our health and our financial futures. So again, I'm thankful to be here, open to your questions. Thank you.
Thank you so much, Jessica. And let's give another round of applause for our panel. You can see that give recognition to some people who are here who are doing a fabulous job and who were mentioned before, but the Colorado Department of Healthcare Policy and Financing Director Loris Meinhold, and Colorado Division of Insurance Director Joe Donlin. Thank you guys for all you do. You can see there's a few questions in the audience, so I've just stacked them up. We're going to try to run through them as fast as we can so we can get as many questions answered as we can. And I'll read the question. If I know something about it, I'll give a quick answer, and then anybody who wants to chime in, please do it, okay? The first question, can you be specific about what the minimum standards that companies are on the marketplace